Multiple choice questions on the topic. Muscular dystrophy with learning disability. Progressive muscle weakness along with difficulties in reading, writing or arithmetic. 1. Muscular dystrophy is primarily a disorder of the A. Nervous system, B. Muscular system, C. Skeletal system, D. Digestive system. Answer B. Muscular system. 2. Which of the following is a common feature of muscular dystrophy? A. Sudden paralysis, B. Progressive muscle weakness, C. Increased muscle tone, D. Permanent joint stiffness. Answer B. Progressive muscle weakness. 3. Duchenne muscular dystrophy, DMD, typically affects A. Females only, B. Elderly men, C. Young boys, D. Adults of both genders. Answer C. Young boys. 4. Learning disabilities are typically associated with difficulty in A. Physical movement, B. Emotional bonding, C. Reading, writing, or math, D. Vision and hearing. Answer C. Reading, writing, or math. 5. Which chromosome is affected in Duchenne muscular dystrophy? A. Chromosome 21, B. X chromosome, C. Y chromosome, D. Chromosome 7. Answer B. X chromosome. 6. Children with muscular dystrophy may need A. Regular medication only, B. Surgery for recovery, C. Supportive therapies and assistive devices, D. No intervention. Answer C. Supportive therapies and assistive devices. 7. Which learning difficulty is commonly found in children with muscular dystrophy? A. Dyslexia, B. Hearing impairment, C. Visual impairment, D. Attention deficit hyperactivity disorder. Answer A. Dyslexia. 8. A child with difficulty in writing due to muscular dystrophy may benefit from A. Oral exams only, B. Physical punishment, C. Assistive technology, D. Isolation from class. Answer C. Assistive technology. 9. What is the role of occupational therapy in muscular dystrophy? A. Improve memory, B. Increase reading skills, C. Enhance fine motor skills, D. Improve digestion. Answer C. Enhance fine motor skills. 10. Which of the following is a type of learning disability? A. Asthma, B. Dyscalculia, C. Arthritis, D. Epilepsy. Answer B. Dyscalculia. 11. Progressive muscle weakness leads to difficulty in A. Sleeping, B. Walking and climbing stairs, C. Understanding instructions, D. Speaking fluently. Answer B. Walking and climbing stairs. 12. Children with muscular dystrophy may experience A. Rapid improvement in muscles, B. Emotional and social difficulties, C. High athletic performance, D. Better balance. Answer B. Emotional and social difficulties. 13. Dysgraphia affects a child's ability to A. Read, B. Do math, C. Write, D. Speak. Answer C. Write. 14. What kind of seating arrangement supports children with MD in classrooms? A. High stools, B. Adjustable chairs with back support, C. Ordinary wooden benches, D. Standing desks. Answer B. Adjustable chairs with back support. 15. Which professional helps in learning disability assessment? A. Cardiologist, B. Neurologist, C. Special educator, D. Orthopedic surgeon. Answer C. Special educator. 16. A common comorbidity with Duchenne MD is A. Hearing loss, B. Intellectual disability, C. Autism spectrum disorder, D. Learning disability. Answer D. Learning disability. 17. Muscle degeneration in muscular dystrophy is A. Non-progressive, B. Reversible, C. Progressive and irreversible, D. Intermittent. Answer C. Progressive and irreversible. 18. What is dyscalculia? A. Reading disorder, B. Writing disorder, C. Mathematical difficulty, D. Speaking problem. Answer C. Mathematical difficulty. 19. What is a common classroom challenge for a child with MD and LD? A. Eating during class, B. Completing written work on time, C. Making loud noises, D. Watching videos. Answer B. Completing written work on time. 20. Children with muscular dystrophy often benefit from A. Rote learning. B. Project-based learning. C. Activity-based and individualized learning. D. Punishment and rewards. Answer C. Activity-based and individualized learning. 21. Who is responsible for creating an IEP, individualized education plan? A. The child's parents only. B. Government officials. C. A team including teachers, therapists and parents. D. Only doctors. Answer C. A team including teachers, therapists and parents. 22. Which assistive device supports mobility in MD? A. Braille slate. B. Walker or wheelchair. C. Hearing aid. D. Visual charts. Answer B. Walker or wheelchair. 23. Early intervention for learning disabilities is A. Not useful. B. Highly beneficial. C. Only for older children. D. Mostly ineffective. Answer B. Highly beneficial. 24. A sign of muscular dystrophy in early childhood is A. Early talking. B. Frequent falling and muscle weakness. C. Sharp memory. D. Early walking. Answer B. Frequent falling and muscle weakness. 25. Learning disability is caused due to A. Poor parenting. B. Poor diet. C. Neurological differences. D. Watching TV. Answer C. Neurological differences. 26. Accommodations for students with MD and LD include A. Extra homework. B. Modified exams and scribes. C. Harsh discipline. D. Isolation. Answer B. Modified exams and scribes. 27. Which of the following helps a child with dyslexia? A. Text-to-speech software. B. Wheelchair. C. Sign language. D. Magnifiers. Answer A. Text-to-speech software. 28. One of the symptoms of learning disability is A. Poor hygiene. B. Difficulty in understanding simple instructions. C. Hearing loss. D. Frequent fever. Answer B. Difficulty in understanding simple instructions. 29. Which therapy helps with muscle coordination in MD? A. Behavior therapy. B. Speech therapy. C. Physiotherapy. D. Occupational therapy. Answer C. Physiotherapy. 30. The teacher's role in inclusive education is to A. Focus only on high-performing students. B. Promote competition. C. Provide differentiated instruction. D. Punish slow learners. Answer C. Provide differentiated instruction. 31. Which of the following is true about MD and LD combination? A. It always leads to severe mental retardation. B. It needs early identification and multidisciplinary support. C. It can be treated with antibiotics. D. It never affects academic performance. Answer B. It needs early identification and multidisciplinary support. 32. A child with muscle weakness may find it hard to A. Listen to music. B. Sit at a desk for long. C. Watch TV. D. Breathe normally. Answer B. Sit at a desk for long. 33. What kind of environment supports inclusive education? A. Competitive and fast-paced. B. Structured, supportive and flexible. C. Strict and traditional. D. Overcrowded classrooms. Answer B. Structured, supportive and flexible. 34. A child with dysgraphia may have problems with A. Calculating. B. Copying from the board. C. Verbal answering. D. Physical activity. Answer B. Copying from the board. 35. Which of the following helps in identification of LD? A. CT scan. B. IQ test and educational assessment. C. B. CG. D. Blood test. Answer B. IQ test and educational assessment. 36. Which support helps in both MD and LD? A. Individualized education plan, IEP. B. Regular punishment. C. Peer pressure. D. Repetition drills. Answer A. Individualized education plan, IEP. 37. Emotional support in the classroom helps to A. Increase competition. B. Reduce bullying and anxiety. C. Create stress. D. Make students dependent. Answer. B. Reduce bullying and anxiety. 38. Which professional designs classroom adaptations? A. Pediatrician. B. Special educator. C. Surgeon. D. Pharmacist. Answer. B. Special educator. 39. Learning disability is A. A disease. B. A mental illness. C. A neurological condition.